He holds a very special place in my heart as he holds the title of being our very first pediatric endocrine fellow here at Norton Children's and University of Louisville. Dr. Dice became interested in endocrinology due to his own diagnosis with type 1 diabetes at the age of 9. Dr. Dice enjoys exercising and outdoor activities of all sorts and has recently been training for and running half marathons. Dr. Brad Thrasher is an assistant professor of pediatrics in the Division of Endocrinology, and he is our physician lead of the Christensen Family Sports and Activity Program for the Wendy Novak Diabetes Center. Prior to joining the University of Louisville and Norton Children's, Dr. Thrasher was on faculty in the Division of Pediatric Endocrinology at the University of Tennessee, where he worked to optimize patient care quality and enhance the medical learner experience. Dr. Thrasher enjoys partnering with patients and families with diabetes and empowering them with tools and knowledge so they too can fulfill their dreams and aspirations. Please welcome Dr. Dice and Dr. Thrasher.
Thank you, Dr. Kingery. So I'm here to talk a little bit about diabetes and exercise, which is very near and dear to my heart because I was diagnosed with diabetes. And with that, I've found that exercise helps me out in so many different ways, including my blood glucose control, but that there are different struggles that can occur while exercising. And those are some things that I just wanted to cover today. So I have no relevant financial disclosures. If someone can help me make a little bit more money, because I am a fellow, I would love to know how. So a quick outline, we're going to review the current recommendations, illustrate the benefits of exercise, briefly review some adverse events that can happen during exercise, and then mostly review motivational strategies. So exercise and diabetes, what's the big deal? Well, this quote is from the opening paragraph of the position statement for physical activity and exercise from the American Diabetes Association. The adoption and maintenance of physical activity are critical foci for blood glucose management and overall health in individuals with diabetes and prediabetes. Even in the 1950s, Joslin, who is one of the really founders of current diabetes management, proposed that exercise is the third essential component in blood glucose regulation for persons with type 1 diabetes, right after insulin and dietary management. But before we get too far into this, let's explore a little history. Well before the discovery and purification of insulin, scientists and clinicians realized that type 1 diabetes caused muscle atrophy, some impaired muscle mass development, and reductions in strength. Celsus noted that people that had polyuria were weaker and had smaller muscle mass. And at that time, because obviously we did not have insulin back, BC, they prescribed regular activity, which actually increased their survival. It was later noted by Aratus, who found that regular exercise improved the disease condition, which was referred to as an awkward condition of melting down of flesh into limbs and urine, which is kind of a gross way of thinking, but really he's describing diabetes there. And then in the 1920s, 100 years ago, in Toronto, they clinically observed that when patients were given insulin, the transformative effects of body growth and development and the increase in that muscle mass. But even outside of those with just pure diabetes, why should people exercise? Really, it should be a part of everyone's daily life. Lee and colleagues published findings in Lancet in 2012 that physical inactivity caused 6 to 10% of major non-communicable diseases, including diabetes. Additional research in the US estimated that inactive people would gain an additional 1.3 to 3.7 years of life just by becoming active. And then in Eastern Asian population, life expectancy in active people was 2.6 to 4.2 years greater than those of inactive people. So if you want to live a little bit longer, you just need to exercise. So I said that one of our learning objectives is going to be, what is the recommendation? And as was previously mentioned in the other presentation, The American Diabetes Association Standards of Care mentioned that children and adolescents should get a goal of 60 minutes of vigorous or moderate intensity activity every day. So you may have seen some of those commercials, NFL Play 60. That's the exact same idea because it's very similar to any other kid. Additionally, they should be doing muscle strengthening or bone strengthening exercises 3 days a week, and then really just decrease sedentary behaviors. So don't drop your kids off at the front of the store, maybe park at that back parking lot area and walk all the way to the store instead of just dropping them off. So we already talked a little bit about the benefits of exercise, but the position statement and guidelines recommend this, but why? What are those exact benefits to our patients? To start, no talk is truly complete without touching on COVID, at least nowadays. So initially, we'll talk about people that don't have diabetes, and then we'll touch a little bit on those with diabetes. So there's been noted that lower rates of acute respiratory infection incidence, duration, and intensity of symptoms, as well as decreased risk of mortality from infectious respiratory diseases in those who exercise. Additional, Jan in 2020 found that exercise decreases the severity of ARDS, which is obviously one of the most feared complications of COVID-19, that a single session of exercise increased the antioxidants as well. Now, talking more directly about COVID, Bronner had published earlier this year that exercise capacity was inversely related to hospitalization for COVID-19, meaning that if you were doing more exercise, there was less chance of hospitalization. And then finally, D'Souza found that individuals that met 150 minutes of exercise a week had a 34% reduction in hospitalization rate due to COVID. So in general, if you don't want to get hospitalized for COVID, one of the best things you can do is just go exercise. Additionally, looking at things aside from diabetes, a Nature Reviews Cardiology manuscript published in 2018 that was not specific to diabetes, but had many of the benefits that overlap with major comorbidities of diabetes found that exercise induces anti-atherogenic adaptations in vascular function and structure. It improved cardiac parasympathetic regulation, prevented arrhythmias, provided cardioprotection, improved myocardial regenerative capacity, and improved a healthy gut microbiota, thus protecting from permeability and function of the gut as well. Looking more specifically at those with diabetes, the first question that people usually ask is, well, does it help your A1C? Because that's what we talk about a lot of the time. McMillan and colleagues helped answer this question by performing a meta-analysis of youth with diabetes and found 11 studies that were suitable for this meta-analysis. Overall, they discovered that there is, in fact, an overall significant benefit of physical activity on the A1C. And that's noted by this forest graph here, where experimental or exercise is on the left versus the controls, which are on the right. And you notice that most of these bars are over on the left-hand side of the screen. For those with type 2 diabetes, Zheng and colleagues looked at individuals with type 2 diabetes who had elevations in their blood glucose in the morning. They had them do fasting exercise before breakfast and had fantastic results. They noticed not only was there a decrease in blood glucose throughout the day, but there was also decreased glucose variability throughout the day and a reduced rise in blood glucose after the breakfast meal. Additionally, Bond in 2015 performed a large multi-center analysis and found that exercise basically improves everything. There was an A1C decrease, as we already mentioned, although it was only by about 0.5%. So you're not going to take someone from a 10 to a 6 just by exercising alone. The rates of DKA were less than halved, BMI decreased, and then all of the comorbidities that we think about that predispose you to worse outcomes like dyslipidemia, retinopathy, and nephropathy were all less in the exercise groups as well. And then finally, it's also well established that exercise helps improve mental health in the overall population. And considering the higher incidence of mental health disturbance in those individuals with chronic diseases, in particular those with diabetes mellitus, Villani and colleagues in 2019 performed a randomized control trial looking at exercise's effect on the mental health of individuals with type 2 diabetes. Their findings were not surprising, as they found that exercise improves self-esteem, overall mental health, with significant improvement in many other factors as well, including anxiety and insomnia. So to summarize that, exercise improves so many different things. There are multiple cardiovascular benefits, which are important to consider for those with diabetes, because that's the long-term outcomes that we are trying to prevent them from having. There's also significant mental health benefits and a small improvement in hemoglobin A1C as well. However, we also need to look at the opposite side. What are some adverse events that can happen with diabetes? First, it's important to recognize that hyperglycemia is not a contraindication, and that we should be aware that an individual with diabetes really should be checking for ketones if they're having hyperglycemia, and the ketosis could worsen during strenuous activity, particularly if they don't have any insulin on board. Additionally, individuals with diabetes must keep in mind that if they've had a prior episode of low blood sugar or hypoglycemia, this prior episode of hypoglycemia will blunt the response to a secondary episode of hypoglycemia, which occurs more frequently during exercise. Speaking of that, let's review low blood sugars and exercise. So a little background. Trigona said the total time of physical activity in those with diabetes was on average 24 minutes lower than their healthy peers. Why? Well, a couple different studies have looked at this, and through questionnaires and online surveys, they found that individuals with type 1 diabetes had a fear of having low blood sugar while they were exercising, and they found that their blood sugars were harder to control. This is further backed by data, and the Diabetes Research in Children Network, or the DirectNet study group, found that during exercise, particularly if your blood sugar was below 120, there was frequent hypoglycemia that occurred if aerobic exercise was performed, and that individuals overnight would also have nocturnal hypoglycemia if they exercised earlier in the day. However, Bond in 2015 did not find that any severe hypoglycemia, meaning those that required glucagon or additional assistance, was any different than those that were inactive versus those that were physically active. So why does this happen? Well, in a person that does not have diabetes, they have increased blood flow to their muscle and increased non-insulin produced or mediated glucose transport via GLUT4. Then that increases the glucose into those muscles that are actively working out. Thus, they lead to a decreased plasma glucose. However, sensing that decreased plasma glucose, insulin gets turned down and counter-regulatory hormones get turned up. However, in an individual with diabetes who's taking insulin particularly, or has excess insulin on board, that increased glucose leads to a decreased glucose, or increased glucose uptake leads to a decreased serum glucose, but you can't turn down the amount of insulin. Thus, your counter-regulatory hormones are also not as high as well due to that excess insulin. And thus, due to the insulin as well as less counter-regulatory hormones, this would lead to low blood sugars. Therefore, there's been a lot of different articles published on how to prevent hypoglycemia during exercise. And there's a great review article that was published in 2017 that reviewed different strategies of how to present this. This is a really busy slide, So we're going to summarize this a little bit later when Dr. Strasher talks about some handouts that we've been providing to families to help manage diabetes during activity. So we talked about low blood sugars. How about higher blood sugars? Well, in 2002, a paper was published that showed increase in adrenergic responses were responsible for rises in blood glucose both during heavy lifting and intense exercise. So as opposed to aerobic exercise where you're running, if you were just doing lifting, they noticed that there might be an increase in blood sugar. Additionally, Gillespie in 2013 found that this adrenergic response was also likely responsible for what's referred to as the game day phenomenon. So on practice days, individuals might have normal blood sugars or low blood sugars, but then when it came to the game, they were so excited about it that their blood sugars rise, and they were confused why this was happening because they thought they were well dialed in. And this is likely due to that adrenergic response. So we know that individuals can have higher blood sugars or lower blood sugars during exercise, but how will this affect their performance? Kelly and colleagues studied youth attending a sports camp. They carried out multiple skill-based tests, including like tennis, basketball, soccer skills, with glucose monitoring over about 4 days. Overall, when the individuals had low blood sugars, their sports performance skills were approximately 20% lower than if they had normal blood sugars. However, if they had elevated blood sugars, there wasn't much of an effect that was noticed. So some of the strategies might have individuals have their blood sugars run just a little bit higher, just to ensure that they don't either have to come off the field or they don't have any reduced skill. So one of our last learning points is how do we get people motivated to get outside and exercise? Because it's really easy to talk about it, but how do we go about it? Well, in the case of diabetes and exercise, quite literally, knowledge is power. And although there's a ton of evidence available regarding the benefits of exercise that we just reviewed, several studies have shown that there's minimal number of healthcare providers that actually counsel their patients about exercise. For example, Barnes and colleagues found that only 32% of patients acknowledged that they were given any sort of physical exercise activity counseling during the previous year when visiting their healthcare providers. Thus, if it is important that we provide education to our patients, do we need to increase our own personal knowledge about exercise? I can only speak from my own experiences, but in my medical school training and my residency training, there wasn't much of a dedicated curriculum to talk about exercise prescription and education and how to get other people to exercise. Thus, if we are never really taught about it, how can we help out? Well, Labello in 2008 did a great study where they showed that physicians that actually were exercising on a regular basis themselves were more likely to recommend exercise to their patients than those that were inactive. Therefore, if we are leading by example and getting out there and exercising, we are more likely to be able to provide that important education to our patients. Additionally, Asante, as well as Littogard, suggested that they just need to find an exercise buddy as well. So if that's a family exercising together, or teenagers finding a workout buddy at their school, or a friend that they can go and hang out with, or in our case, if we can find a colleague or a significant other that will go and exercise with us, we are more likely to be successful with those exercise routines. So, some parting considerations in summary. Exercise is a key component of diabetes management and complication prevention. I hope that that was well illustrated today. And we need to, as physicians and care providers, incorporate exercise education into all of our patient care visits, regardless of whether it's for weight control or for any other purpose, and even for those without diabetes. But we also need to be aware that all people with diabetes are a little bit different. They have different fitness levels and different comfort with their blood glucose control, different tolerance of high and low blood sugars. And we need to tailor their diabetes needs and their exercise needs to the individual. And that's usually done through trial and error. Lastly, I just want to review some of the celebrities. First and foremost, let's talk about Adam Duvall, who just won a World Series. He has type 1 diabetes and has talked about having diabetes as an individual who plays baseball. So we all need to congratulate my fellow type 1 diabetic about that World Series win. This is Sarah Groenewegen, who's an Olympic softball pitcher from Canada. This is Mark Andrews, who was diagnosed as a young child and has actually talked with multiple people about how it was growing up and exercising with diabetes, and is a great role model for those that are growing up and living with diabetes. Jay Cutler was also diagnosed with diabetes, and I sometimes wondered if some of his poor performances on the field may have been affected by low blood sugars. Antonia Goransson is a soccer winger for Sweden. This is Wasim Akram, who is a world famous cricket bowler from Pakistan. Kelly Cohen, who is an LPGA golfer, and you can see her insulin pump here on her waist, which just allows people to see, oh yes, other individuals with diabetes can get out and be active as well. And lastly, this is Robin Arzon, who is very well known for being a Peloton instructor, but she also runs ultra marathons, like 126 miles at once. You can also see her pump on her arm as well. And with that, I will turn it over to Dr. Brad Thrasher to talk a little bit about the Christensen Family and Sports Activity Program.
Thank you, Dr. Dice, for that overview there on exercise. And I cannot get my camera to work, so forgive me for that. So just listen to the sound of my voice. I am going to share with you all this extraordinary clinic that we have available to our patients with diabetes here in Louisville. And I truly believe it's a one-in-a-kind program for children, adolescents, and young adults living with type 1 who want to kind of get more in tune with their glucose control, nutrition, and just improving their overall performance. So the Christensen Family and Sports and Activity Program, our goal is to provide clinical care to individuals and their families through patient-centered and community education and clinical research. The care that we provide is focused onto giving the patients insights into blood glucose management, while also improving the health, safety, and athletic performance of all of our participants, no matter their sport or activity. We have a team that's part of this program, and this includes endocrinologists, exercise physiologists, registered dietitian nutritionist, and even a dedicated diabetes educator. Our team evaluates the athlete's physical needs to provide an individualized plan to enhance his or her sport or everyday performance. We also work with the athlete support team, which is parents, coaches, athletic trainers, et cetera, to provide care across all levels. We collect information on the timing of food and insulin dosing, sleep habits, performance records, and blood sugar levels prior to, during, and after exercise. And then we use all this data to provide recommendations, guidance, and education as needed to provide the patient with kind of the best diabetes management plan they can have moving forward. Another key component of our center is innovation through clinical research. So our research explores, diabetes, exercise physiology, sports nutrition, and we're hoping to discover new and maybe even better ways to help improve athletic performance of those living with type 1 diabetes. The slide that you currently see, this was in the news probably about 2 or 3 years ago. And this is a little leaguer who was playing in the Little League World Series with diabetes. And the reason, I bring this up is that type 1 diabetes affects 1 in every 400 children, adolescent, and young adult under the age of 20. And, I think as we've shown in some other lectures, the incidence of type 1 is increasing. And we want to empower the individuals living, with type 1 so they can continue to perform at the levels that they want to perform at and not have their disease hinder them such that they stop participating in things that bring them joy in life. So I hope that through our clinic that we get to see more stories like this in the future. One of the ways that we're trying to help kind of empower our patients and their family is just through communication. And what you see on your screen now is just a diabetes activity care plan. And this is a plan that is provided to families and patients when they enroll in the program. And it's kind of, if this is what's individualized to them. Now, this is what you see is kind of just some starting guidelines that we then tailor as we learn more about that person. And we encourage the families to share these guidelines, with trainers and coaches or whomever else is, helping watch over their loved one during their sport or activity event. Because we want them to have the knowledge of what should, Susie's blood sugars be before she participates. What kind of changes is she making to her insulin pump or her insulin regimen, before and after activity. And then kind of giving them some guidelines to go through too, as to before activity, making sure we're checking that we're in safe ranges. I didn't put all of the guideline here for you to see, but it does go through scenarios if Susie has a low blood sugar as to what should be done. If Susie has a high blood sugar, what to be done. So again, we're just trying to provide knowledge and education to all those that are caring for, our participants with type 1 who, want to stay involved in sport and activity. Here, I just wanted just to quickly mention some of the research that we've still been able to do through the pandemic. We recently just wrapped up a study which looked at continuous glucose monitors accuracy during exercise. So basically, we had the participants kind of just run on a treadmill and then monitor their blood glucose via their CGM and also point of cares at different intervals to kind of see what if there was any differences there. So we just wrapped that study up. We're currently analyzing the data and hopefully we'll have that published by early spring of next year. We've had some publications. These are the kind of the 2 most recent ones recently go through. And it's just kind of looking at kids that participate in the program using kind of consumer-based activity monitors, otherwise a Fitbit, just to kind of monitor activity to provide, the docs with kind of just better education or better knowledge on the kids' activity level. So we can hopefully therefore make better recommendations to their diabetes management. The retrospective chart review, there's a lot of studies that are, there's a lot of studies that can come from that one, but Dr. King, she's a scientist that collaborates with us, and she's currently working on a paper just looking at their gender differences in those with type 1 and the sports that they participate in. And then we also recently looked at kind of just VO2 max, which is just a measure of cardiorespiratory fitness in those with type 1. And, can you safely have people with type 1 or individuals with type 1 perform a max VO2 test so you can just learn more about the fitness, and we showed that we could. So, research is also a big component of what we're doing because, again, we want to enhance knowledge and just improve the future for those living with type 1. And then this is a picture of really those that are I'm going to say the big players in the program. So you see Mr. Eric Davenport there, who's talked earlier. He's the registered dietitian, our diabetes educator. Mr. Tim McKay there, he's our exercise physiologist who does all the exercise programs or puts the kids on the treadmill and all the fun testing that the kids enjoy. And then you see myself there, the blonde-headed young one, one of the endocrine docs. And then beside me is Dr. Wintergers, who is our, of course, division chief and then director of the Wendy Novak Diabetes Center. So we meet a lot just to see like where we're going to go. And then lastly, I threw this picture up here. This is Mark Andrews. And I don't know Mr. Andrews at all, but I find his story really inspiring because he was diagnosed with diabetes at a very young age, at age 9. And I recently read an article that was in USA Today where he lists type 1 as one of his greatest strengths. And basically, I'm just going to paraphrase him. He said, living with type 1 has armed him with the physical, mental, and emotional strength to achieve his dreams. And I hope that those individuals that participate in our program, I know that most of them probably will not go on to become professional athletes, but I do hope that we're empowering them with the resources and knowledge so that they feel that living with type 1 is a strength and not a hindrance. And that is kind of our sport and activity clinic in a nutshell.